Are you struggling with erectile dysfunction? In this lesson, we are going to look at how to properly use sildenafil to treat erectile dysfunction. Hi everyone, my name is Tom Waswa, a medical biochemist. Here, we deal with medical biochemistry, pharmacology, their exams, revision questions and answers, and so forth. So feel welcomed. If you find this video helpful, please don't forget to like it, subscribe, and also hit the notification button. So we are going to begin by looking at what is an erectile dysfunction. Erectile dysfunction refers to the inability to achieve and sustain an erection long enough to allow for sexual intercourse. Erectile dysfunction is a prevalent issue among majority of men today. So first of all, let's look at the symptoms of erectile dysfunction. So the first symptom is inability to achieve erection. Another symptom is inability to keep erection. And finally, reduced sexual desire. So those three are the major symptoms of erectile dysfunction. So before we go to the proper use of sildenafil to treat erectile dysfunction, number one, I would like us to look at how erection occurs. How does an erection occur in men? So for erection to occur, number one, you need an arousal. What is an arousal? So an arousal refers to a stimulus that can lead to erection. So what can lead to arousal? When you hear something, there are some people who get aroused when they hear a certain voice. Then you can also get aroused by feeling. You can feel something from the environment. Also, you can smell something. So certain smell can turn people on. After the body gets aroused, nitric oxide is normally released from the corpora cavernosa of the penis and also from the nerve terminus. Nitric oxide activates an enzyme known as guanylyl cyclase. So the role of guanylyl cyclase is to activate the conversion of GTP into cgmp. Now, what is cgmp? cgmp means cyclic guanosine monophosphate. Cyclic guanosine monophosphate is a very important hormone. So the conversion of GTP into cgmp activates or triggers what we call cgmp dependent cascade of events. Stimulation of cgmp causes smooth muscles in the corpora cavernosa of the penis to relax. So the relaxation of these smooth muscles causes blood to flow through the veins of the penis, causing firm erection. Let's look at phosphodiesterase 5 enzyme before looking at what stops erection. So phosphodiesterase 5 enzyme is predominantly found in the corpora cavernosa of the penis, and its role is to cleave cyclic GMP into its inactive form. So let's look at now what stops erection. Now the stimulus of nitric oxide goes away. And number two, cyclic GMP is cleaved into inactive form by phosphodiesterase enzyme. Now, the body generates nervous response to ejaculation. After ejaculation, the nervous system causes muscles, smooth muscles to contract. So this pushes the blood out of the penis to other parts of the body, causing it to relax. We want to look at how sildenafil works to treat erectile dysfunction. Now, sildenafil, together with other medications that are used to treat erectile dysfunction, work by inhibiting phosphodiesterase 5 enzyme. We have just said that the role of phosphodiesterase enzyme is to cleave cyclic GMP into its inactive form. So, sildenafil and other medications, that is tadalafil, they work by inhibiting the phosphodiesterase 5 enzyme. So that's why they are called phosphodiesterase 5 enzyme inhibitors. The structure of sildenafil and other phosphodiesterase 5 enzyme inhibitors are similar to that of cyclic GMP. These medications work by competitively binding to phosphodiesterase 5 enzyme. So this prevents phosphodiesterase 5 enzyme from binding to cyclic GMP and therefore converting cyclic GMP into its inactive form. So this enhances the effect of nitric oxide on the penile smooth muscles and therefore prolonged erection. Next, let us go to dosages. The available dosages are 25 milligrams, 50 milligrams, and 100 milligram dosages. The recommended dosage is 50 milligram dosage, which should be taken 30 minutes to 1 hour before sexual intercourse. Maximum dosage is 100 milligrams per day. Please note that this video is for informational purpose only, so seek medical advice from your healthcare provider. Also note that sildenafil is not meant to cure erectile dysfunction. It is only meant to boost someone's erection for a while. Next, we go to pharmacokinetics. This drug is normally taken per orally and it is quickly absorbed in the GIT. It is metabolized in the liver by cytochrome P450. It's important for you to note that drugs which induce liver enzymes such as phenytoin and also rifampicin increase sildenafil levels in the blood. On the other hand, liver enzyme inhibitors such as ketoconazole and erythromycin work by decreasing the level of sildenafil in the blood. Let's go to food interactions. So absorption of sildenafil is normally affected by foods with high fat content. So sildenafil is best absorbed on an empty stomach. Under excretion, you need to know that sildenafil is excreted in urine and also in feces. Next, let us look at contraindications. Sildenafil is contraindicated in patients who are taking drugs rich in nitrates. An example of such drugs is the nitroglycerin, which is normally used for the treatment of angina. It is normally placed under the tongue for absorption. So, when you take sildenafil together with the nitroglycerin, this leads to hypotension, that is reduced blood sugar level, so it can easily lead to death. Kindly consult your healthcare provider for more information. We go through our notes. Erectile dysfunction, inability to achieve or sustain an erection long enough to allow sexual intercourse, a prevalent issue among men. Symptoms of erectile dysfunction: trouble getting an erection, trouble keeping an erection, reduced sexual desire. How erection occurs. For erection to occur, we need arousal, that is a stimuli. So arousal is caused by feeling something from the environment, hearing, smelling, or touching. After getting aroused, nitric oxide is released from the nerve terminals and the cells of the corpora cavernosa of the penis. Nitric oxide activates an enzyme called guanylate cyclase, which converts GTP into cyclic GMP, which is a hormone. So this triggers cgmp-dependent cascade of events. Accumulation of cgmp causes smooth muscles in the corpora cavernosa of the penis to relax, and this increases blood flow to the penis, causing firm erection. Phosphodiesterase 5 enzyme. This enzyme is predominantly found in the corpora cavernosa of the penis. Its role is to cleave cyclic GMP into inactive form. So what stops erection? The stimulus of nitric oxide goes away, cyclic GMP is cleaved into inactive form, the body generates nervous response to ejaculation. After ejaculation, the nervous system causes smooth muscles to contract, forcing blood out of the penis to other parts of the body, causing the penis to become flaccid. How does sildenafil work therefore? Sildenafil and other medications used to treat erectile dysfunction work by inhibiting phosphodiesterase 5 enzyme. So they are called phosphodiesterase 5 enzyme inhibitors. The structure of sildenafil and other phosphodiesterase enzyme 5 inhibitors are similar to that of cyclic GMP. They competitively bind to phosphodiesterase 5 enzyme and prevent it from hydrolyzing cgmp into its inactive form. This enhances the effect of nitric oxide on the penile smooth muscles, leading to prolonged erection. So dosages of sildenafil. Available dosages are 25 milligrams, 50 milligrams, and 100 milligram tablets. The recommended dosage is 50 milligram and should be taken 30 minutes to 1 hour before sexual intercourse. So maximum dosage is 100 milligrams per day. Pharmacokinetics. It is taken per orally and is quickly absorbed from the GIT. It is metabolized by cytochrome P450 enzyme in the liver. Drugs that induce liver enzymes such as rifampicin and phenytoin increase blood levels of sildenafil. Liver enzyme inhibitors such as erythromycin and ketoconazole will decrease sildenafil blood levels. Food interaction. Absorption is affected by foods with high fat content. Excretion. It is excreted through urine and feces. Contraindication. It is contraindicated in patients undertaking nitrates, e.g. nitroglycerin. That is a medication commonly prescribed for angina, normally placed under the tongue, so taking both can lead to hypotension, that is reduced blood pressure, and may lead to death.